U.S. patients and drug makers will get a first glimpse of how much Medicare can negotiate down drug prices in 2024, setting the precedent for a controversial process that may affect what seniors pay for dozens of medications by the end of the decade. It could also be a pivotal year for the lawsuits that drug makers, including Merck, Johnson & Johnson and Bristol Myers Squibb, have filed against the price talks. Decisions could come down in some of the cases next year, which could eventually escalate the issue to the Supreme Court. President Joe Biden's Inflation Reduction Act, which passed in a party-line vote last year, gave Medicare the authority to directly hash out drug prices with manufacturers for the first time in the federal program's nearly 60-year history. Medicare is negotiating prices for the first round of 10 prescription drugs in a bid to make those costly treatments more affordable for older Americans. By the fall, the federal government will publish the agreed-upon prices for those medications, which will go into effect in 2026. The outcomes of the talks will have huge stakes for the pharmaceutical industry, which views the process as a threat to its revenue growth, profits and drug innovation. The final prices will determine how much revenue the companies that make the drugs can expect to lose in a few years. The figures will also give other drug makers an idea of how much their sales could be affected if their medications are selected for future rounds of negotiations. But the final agreed-upon prices are also significant for patients, who will get a first look at how much money the talks will save them at a time when many older people increasingly struggle to afford medications. We're going to see how much that program is able to negotiate, and it'll give patients who are already on the drugs an idea of the savings they're going to see, said Leigh Purvis, a prescription drug policy principal at the AARP Public Policy Institute. AARP is the influential lobby group that represents people older than 50. The organization has advocated for Medicare's new negotiation powers. The drugs subject to the negotiations are among the top 50 with the highest spending for Medicare Part D, which covers prescription medications that seniors fill at retail pharmacies. In 2022, 9 million seniors spent $3.4 billion out of pocket on the 10 drugs, and some paid more than $6,000 per year for just one of the medications on the list, according to the Biden administration. Nearly 10% of Medicare enrollees ages 65 and older, and 20% of those under 65, report challenges in affording drugs, the administration said in August. Medicare covers roughly 66 million people in the U.S., and 50.5 million patients are currently enrolled in Part D plans, according to health policy research organization KFF. The Biden administration officially kicked off the negotiation process in August when it named the first round of medications subject to the price talks.